Sego Seguego, and welcome to our year in review. We're talking about the year of the pandemic, and today we're going to be looking at the last 365 days of dealing with an unimaginable situation. I'm Regan Jacobs, and I'm in studio with my co-host Doug Jacobs. And we're going to be, like I said, looking at these past 365 days and how Akwesasronon in particular has shown strength and courage in dealing with the COVID-19 reality.
Yes, so happy anniversary, or maybe not so happy anniversary. It was a year ago, last March, that we were basically all sent home to await instructions on how to move forward with our lives, with our jobs, with everything. So it's actually we've been doing this for a year. I wanted to jump right in with a live broadcast that we did with the Director of Communications from the St. Regis Mohawk Tribe, Brendan White, on March 16th. In which he announced both sides of the tribe, North and South MCA and SRMT, declared a state of emergency for the tribe. They immediately went into canceling tribal monthly meetings, for example, the work meetings. The casino was closed on March 17th. They shut their doors. They eventually did open in August, at the very end of August, but months and months and months of no casino.
Yeah, so I remember that announcement. I think we have a good picture that we can probably reference where myself, you, and Brendan are standing in the doorway or the lobby of the tribe's building, and you can see that we're looking at paperwork, and somebody snapped that photo of us, and it was so intense, and it was an intense moment. We were getting ready to go live. I remember that day and just thinking, like, is this really happening? Like, and then all that followed.
There were so many question marks at that time. And then over the next few days, representatives from MCA and SRMT were on CKON, which we broadcast those things as well. Derek Cummins and Scott Peters from MCA were speaking on behalf of the emergency operations centers, which all were activated right at that time. So they were talking to the community about what they were doing, things like food delivery. They also on CKON had, people like Dr. Kelly and Teresa Gardner talking about all of those precautions that we were supposed to be taking. All of a sudden, masks and social distancing was, on the top of everyone.
I don't think, when you look back at the beginning, though, I think it took a while for those masks to kick in. Remember, because I think at the beginning, nobody really understood the full impact of the virus and how quickly it was. It was, what's the word I'm looking for?
Transmitted.
Yes, thank you. How quickly it was transmitting.
That same month, at the end of March 21st, the chiefs were speaking, where we were broadcasting their speeches and having discussions about just staying safe in the community. So you're right. It took leadership and sort of just constant reinforcing in everybody's brains that we had to wear masks. We weren't allowed to be having big social gatherings and all of that sort of stuff.
Yeah.
And then we were sent home, and that was the whole sort of navigating working from home.
Yeah.
And I was going to talk just quickly about all of those broadcasts that we did. I didn't go back.
Yeah. As every reporter, including us, all the journalists around the country started to adjust to broadcasting from home. And some of our earlier broadcasts were a lot about what was going on in the number of cases and things that were developing. And I look back at some of those broadcasts earlier, like March and April,
Right.
and we did a fantastic job of being able to keep the community up to date.
Yep. Yeah.
March 23rd.
March 23rd was my first broadcast from home. And I remember we'd had meetings about how it was going to work with the Zoom. And by that point, everybody was forced basically to understand what Zoom and that sort of software was all about, because before you knew it, everybody was going to be conducting meetings. And I was going to say some of those broadcasts, yes, we were talking about statistics in the community, which were staying low at that time, but we were also talking about, especially as the months went on, finding ways to keep sane, to keep active, to explore different possibilities in terms of hanging out with your family and cooking meals. And I was pulling things out of the hat, like, I guess I'll talk about cooking corn soup today. But it was interesting and a challenge, I think, in many ways, to keep finding new ways to stay positive and to broadcast information that was upbeat instead of the same, okay, we have 3 more cases and stuff like that.
Yeah. And I think at some point we veered off of that too, because the EOC came on and they started doing weekly updates with regards to positive cases and expectation from the community. And they were very clear on their mandate. There was no travel ban that went into place. And as it started to like sweep across the nation, I remember being advised, like, stay home, do not travel between the communities. And I was like, what? It was just so crazy at the beginning. But then as the community started to react and you could see everything from the tribe to health services to EOC and our media getting things out to the community, like, I felt we were such a great representation of what you can do when you have to pivot, and you have to pivot in times where it requires you to think outside of the box. And I feel like, we captured a lot of that in this past year, just ATV wise,
Right. I was going to talk about, just quickly, as the months went by, of course, they were doing testing at the health services, but then in September, they began the drive-through testing. I interviewed Stacy Holcomb there, and the drive-through situation, which still is happening, today. Just making it so easy for community members and also non-community members who worked in Akwesasne to drive through at the IGA building and get tested. And I think that's when things started switching gears in terms of really being on top of what your status was, especially if you had symptoms, if you were suddenly coughing or having fevers or that sort of thing. So the tribe was really instrumental in making that easy for the community to jump in and get tested. And then you want to talk a little bit about the help that was given with CARES Act funding. All of a sudden, that was in our community.
Yeah. So, as things were developing, the tribe had obviously applied for emergency funding with the closure of the casino, which had a huge impact on the tribal general funds, right? And we were also hearing about that at a very deep community level, where there was a lot of people that were let go from their jobs. They were sent home. They weren't safe to work in those specific types of jobs. And then just with a lack of funding, a huge funding cut to the tribe. So, on the heels of that, there was this assistance through the CARES Act funding. And I can't speak as well to it as obviously administration could, like Jalessa Barrero or Star Thomas, but I feel like we've covered enough of it to understand that these funds were obtained to help the community in this time of challenging time, provide relief. So I think the administration did a great job of securing those funds, and also be very forward thinking in how they were going to utilize those funds. So part of that was also, part of that was also Mohawk Networks, right? There was a huge upgrade that happened that you covered, Doug, and which had an extraordinary impact on the community in a positive way.
That's right, because suddenly, all of a sudden, people were depending on their internet for everything. I was going to mention also with the CARES Act over the holidays, that helped provide so many holiday meals and just assistance food-wise and financial-wise at a time when, you know, Christmas, Thanksgiving, all of that, when so many parts of our regular lives weren't happening. You know, we weren't spending holidays with our families, so they really stepped up and provided the meals. We covered that. Also, the IGA building where they were distributing meals, and I think that is pretty fantastic in terms of taking care of each other. You know?
Yeah, and I think that was a huge priority for tribal council and administration when they looked at, you know, what was really needed in the community. So aside from those drive-through testing sites, there, you know, this whole home delivery even of foods and services for healthcare, mental health, things that were really impacting the community. They were able to look at how can we adjust during this time where we know we have these very specific health issues that, you know, we're dealing with. We need to have safety measures in place. But I think it's very inspiring as a community to look at our organizations at the forefront and how they were able to adapt and help service the community better, so that people weren't feeling left out and they weren't, you know, they were able to access important services.
Right. I was going to say around the holidays, beginning with Thanksgiving and then into Christmas, our numbers in Akwesasne did start to increase. Finally, we had waited for months and months. Everybody was doing so well, but because of social gatherings, people just not able to control themselves and really wanting to be with family and friends. I think, I mean, it's just human nature. It's just the way we roll. That's where we started to see the effects of what gatherings could do. I know that's not a great point to make, but you know, when we were doing so well, there was a change around the holidays. So that's something to note, I think, in terms of COVID numbers that we've been watching for a year now, up and down, up and down.
Those numbers, they did rise, and we were seeing that kind of data across many of our Native communities that were close in proximity to each other in Kahnawake, Pananega. You were seeing these cases rise and come back down. And even here in Kahnawake, closest to Quebec, I mean, we had the harshest shutdown after a while, right, where our numbers went nutso and we had to shut the province down. So I think that you guys started to experience that second wave a couple of months after us, where you're seeing a number of cases on the rise over there and things like that.
Right. And to your point about even yourself sometimes struggling with just all of the frustrations that were presented to us, the discussion of mental health was something that I was aware of in covering what was happening in the community, because so many people were talking about it. And health services, the behavioral and mental health department, part of that was reaching out and saying, we want to help people and we are available. The Holistic Life Foundation was doing a lot of things to sort of get physical and explore meditation and yoga. Waiahawi Hall did a piece with us about mental health and listed off all sorts of things because we knew, you know, I think we really knew that people were being challenged emotionally. And it was very frustrating. She talked about, Waiahawi talked about elders who were by themselves and couldn't have visitors because, of course, they were more high risk. And then also kids who were losing their minds because they couldn't be in school. And then the parents of those kids who had no idea how to
Yeah.
wrangle their children who were home, as you experienced, every day driving you bananas. So it sounds funny, but you know, these were serious things that were happening that people had to
Yeah.
navigate. Um,
Yeah, my hats go off and my hat goes off and my heart goes out to all of the parents who were at, in March, if I look back at March, had to finish off the school year, homeschooling their kids. And I was one of them. So I know how crazy that is, especially if you have more than one. It was like, my son in the living room, my daughter downstairs. It was nuts. And you never really had to do that before, and try to figure out what was going on with work, try to keep your family safe.
so flash
So
forward to now,
yeah,
vaccines began
vaccine.
at the end of this December. We showed some of those first vaccinations happening at health
Yeah,
services, and that was exciting. And that's kind of where we're living now. You're in queue to get your vaccine, hopefully.
yeah,
My mother's had both of her shots. I have so many older relatives and in my life that I'm so happy that they're vaccinated, and I think there is a little bit of a relief in that,
mhm,
a sense that you know, the more people that get vaccinated, the better off we're going to be. So all of those
yeah,
statistics are coming out, and about if you've been vaccinated, hanging out with somebody else who's been vaccinated, and maybe you don't need to wear masks. And you know, it's never going to
yeah.
be back to normal. Like, we can't say let's get back to normal. I think the world has changed
Hmm.
considerably
I
because
know
of
there were. Sorry, go on.
just because of the pandemic. You know,
Yeah,
everything has changed, the way we sort of look at touching surfaces in a public area, you know,
yeah,
for example.
yeah. I think that there was I know we're going to wrap up in a few minutes, but I just wanted to touch on the vaccination. I know that we as a station had covered some of those Moderna vaccines when they first arrived in Akwesasne. And then we spoke to Dr. Kelly and St. Regis Mohawk Tribal Chief Bev Cook, and they did a phenomenal job at explaining the vaccine, the pros and cons of it. And I think people had a really great start to look at how that process was going to unfold in Akwesasne, which was really important because there was a lot of questions coming from community members about the rollout, side effects, things like that. And I think as a station, we did a great job. And now, the tribe and well, the community at large is going through the entire vaccination process. And hopefully you're going to start seeing some changes from there, moving on into the future as the next couple of months. We may have different data coming out that seems to be putting us in a more positive predicament, or a better predicament than we've been dealing with in the last year.
In the last year, that's right.
Yeah.
And it feels, I will say, it feels good, um, to have that sort of exist in the world, because uh, the first broadcasts of Derek Cummins and uh, the other gentleman from MCA talking about rolling out EOC, the Emergency Operations Center, they said this will maybe last 6 weeks, maybe into
Mhm.
July. They were talking about having the EOC activated for just maybe 6 weeks or maybe a couple months more.
I remember that.
And when I watched the video yesterday, I was like, ooh,
Yeah.
we didn't know what we were up against.
We
So
did have time frame, and I want to think back to like when the big announcement came down with the casino closing, and they were closed, March, April, May, June, July. And then when they reopened, they had just overhauled their gaming floor, and we got to cover that too. And all of the safety measures and precautions that were put in place. I mean, they did a phenomenal job. They continue to do a phenomenal job. And really, it was looking at the best interests of the community, right, and trying to find some sort of way to keep that operational, and providing some much needed funds for the community, and just being able to do the amount of work that they did in the amount of time that they have. I mean, that was monumental to me. Like, it really stood out. among like other things, like just, you know, keeping in contact with health services and looking at all their frontline workers and what they were going through and experiencing on the front lines, dealing with community members every day, and these fears and frustrations of dealing with coronavirus. I mean,
Right.
you know, I think it's something to really be proud of, that we've come through this as a community, and even in, you know, in collaboration with our other First Nations communities who were experiencing some of the same issues that we were.
Right. So even though the vaccines are happening, and we just did create a piece for the tribe called Hold the Line,
Mhm.
which you can see uh, anytime you like. But the discussion, basically, the message that's very beautifully done is just about still keeping your guard up and following, whether or not you've been vaccinated, just paying attention to those sort of rules that we laid down, you know, a year ago, in terms of
Yeah.
hanging out with people without a mask inside a building for too long, large crowds, washing your hands. I think it's still important. And then we can get to the place where we want to be, with a family
Mhm.
reunion and a gathering outside. But until you know, everything is sort of locked down with vaccinations, we have to hold the line. And I think that's a really good message. We can still feel good inside, but we just have to take care, um, you know, for a while.
Yeah, and you know, I love that video. I think the team did a great job on that. I hope people are getting the opportunity to view it. But it's really, that message is definitely there. It's sacrificing now, you know, for a future that is
That's right.
healthier and brighter. And so, yeah, I think
Right.
we're all looking forward to that moment
I
where we can
tell you,
keep.
I got to get on a plane. Um, So
Yeah.
I will say that it was interesting to look. I know we did this quickly, and there were so many details
Yeah.
that we sort of moved through, and of course there are so many people to thank and
Mhm.
to be grateful for in our community, in your community. Um, and I think it's interesting that we can look at these bits, because these timelines, because we captured them. So we have interviews, we have footage of the chiefs talking about, we have Derek talking about, and doctors and nurses, mental health specialists, all of those things that we covered. So we can look at that. And it's great to see the diligence put forth by the community, by our leadership, by parents dealing with kids out of school, by everyone. We all had to deal with it in some sort of capacity, emotionally, financially, just constant worry. Um,
Mhm.
so, you know, I think I was going to say, there were times back last May, June, where I thought, I don't know, I might have to put my head in the oven. I just didn't know how to, you know, and you just had to be patient. So I commend myself, and I commend Akwesasne and just the whole community on staying strong and just handling this the best way they could.
Yep, I agree. You know, looking back, I know that over the last year, with all the coverage that we've been doing as a station, there's a lot of moving parts to this, and I know we can't get to everything, but I definitely think that we tried to honor our first responders, that were always working on the front lines. I know there was a lot of changes even over at Tribal PD and how they were handling situations in the community. That's one of those things that we didn't cover often, but there was a lot of movement, you know, on their part in terms of working the front lines with the community. I can only imagine. But there was a lot of people who did a lot of work, you know, on the back end of things, that we didn't hear about, but we got to see because we work with them all the time. So, I mean, that is just amazing to me. And, you know, I'm really proud to have worked throughout this pandemic, and we worked sometimes 7 days a week, you know what I mean? And we work all the time. But I'm really proud because at the same time, I got to see so many things that were just made me feel like, wow, we really have a great community and people working in our best interests and working for our health and the safety of the community. And we got to see all that. We got to see a lot of behind the scenes moments that maybe the general public wouldn't see, because we're media and we talk to everybody and we know a lot of different details, right? So just made me feel really proud to be a part of this team. And
great. Yes. Well, thank you for joining us, those who are watching. And I'm Louis Jacobs for Akwesasronon TV. Thanks for watching our Year of the Pandemic.
Yeah. Anna. Yo hane